Overall, with both sides having convincing arguments, age still plays the most important factor in triage and who should be treated first. As the con side stated that it is an act of injustice to choose which patient to care for based on age, this is still the best way to reach the best outcome in medical triage, which is considered to be the most possible lives saved. Opposers might argue that this is unfair as it would be deciding whose life is considered more valuable. However, this is not the case. Another argument that supports our reasoning that age should always be prioritized in triage is based on the amount of years one has left to live. In comparison to the amount of years one has already lived, in the case of young versus old, a young person has much more of their life to live and experiences they have not yet had the chance to discover. Life expectancy also plays a role in this determination, as a young person typically has more strength and healthier immune and bodily systems to fight off an injury, therefore having a better survival rate. As said in our opening statement and rebuttal, younger people will be the most likely to recover from a serious injury, while older patients are more likely to have pre-existing conditions that could prevent them from being saved, therefore helping younger patients first will result in the greatest number of lives saved. Both young and old patients have family to consider. With that being said, treating older people first for the sake of their families and children is an ineffective argument, due to the fact that younger patients have families and parents who could lose them also. These points made in the rebuttal and opening statement set the stage for the reasoning as to why age is always a priority.
In conclusion, age should always be a priority in the process of triage for all of the previously stated reasons. In addition, a final reason to prioritize patients based on age would be that older patients will require more time and will experience the most complications due to underlying conditions or medications that are necessary at the time of injury, ultimately requiring more time and medical resources. With that being said, in the time it takes to treat the older people, it may be too late for the second patient, while it could be the opposite if the younger person was tended to first and then healthcare professionals could also help the second patient. While both may need immediate help, it would ultimately be more effective to save the life of someone that has a higher chance of survival, rather than jeopardizing this patient in an attempt to save the life of someone with further complications. In such a case, age plays an extremely important role, as it could mean 2 lives are saved versus the life of one. This argument goes along with the statement that younger people will recover quicker, while older people will take longer with recovery and medical aid itself. Both sides of this debate gave good reasons for being for or against age being a priority in triage, but overall, age is the most important factor and will result in the most positive outcome and save the most human lives, as age is a huge factor in survival versus mortality rates.